Hi, Sydney. My name is Jake. I'm a student physical therapist at Concordia University. Do you mind if I work with you real?
Yes.
Excellent. Let me get some hand sanitizer real quick. Excellent. So, I understand you were in a car accident. So, can you tell me a little bit more about that?
Okay, so when I crashed, I had pain in my neck and my right shoulder, sharp pain right away, and I had some pain in my left shoulder too, like right here.
Okay.
And now I'm having kind of like tightness and pain in my upper back.
Okay.
And initially when I crashed, I had like tightness in my hands after squeezing the steering wheel, but that's kind of gone away now.
All right. You mentioned the pain in a variety of places, just kind of on an overall scale. If you had to grade that from 0 to 10, 0 being no pain at all and 10 being you needed to go to the emergency room, where would you rate your pain right now?
Probably a 6.
Okay. So since the accident, what kind of things haven't you been able to do, or what are you trying to get back to?
Working hurts when I am, like, if I work for 2 hours or so, that's when it starts to bother me quite a
Okay.
bit. If I'm sitting on my laptop, that's painful, and also picking up my baby is painful too.
Okay. Is it just you at the home, or is there somebody else?
My husband.
Okay. Is there anybody else in like your support group that you kind of rely on that can help out?
Yeah, my parents live nearby.
Okay. All right. Well, the next thing that I kind of want to get into is just some exam. And so we're going to perform a bunch of tests and just kind of see if we can't figure out what's going on, okay?
Okay.
All right.
Okay, we're just going to take some vitals. Do you have an arm preference at all?
It's on whatever's easier.
Okay. Let's have it here. You can just relax. All right, little squeeze here. So about 120 over 74, so that looks good. And then I'll check your pulse. Alright, good. Heart rate is about 82. We're going to go ahead and do reflexes now.
Okay.
So I'm just going to tap you lightly like that. Go ahead and relax for me. That looks good. 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 Alright, go ahead and have your hands out like this. And then just relax. I'm going to kind of hold on here. And then same thing with the other hand. So how fast were you going in your crash?
55.
Okay, 55. So that's pretty fast. Alright, I'm going to bring this pen in towards your nose and I want you to stay focused on it with both eyes. Good. And again, just look at the tip. Good. And left. Good. Now follow the tip of my pen with just your eyes. Don't move your head. Any headaches, dizziness,
No.
vision changes, trouble sleeping?
Trouble sleeping.
A little bit? Okay. So now both tips,
Okay.
look back and forth as quickly as you can. Alright, that all looks good. I'm going to have you lay down on your back with your head facing that way. And then we would obviously dim the lights. I'm going to go ahead and just kind of take a look at the ligaments in your neck and make sure that everything is looking good before we do stuff. Can you open your eyes for me?
Yep.
And just look straight up. We would hold this for a minute, if tolerated. And now, just gonna come on C2. And again, keep those eyes open and look at me. Okay. Alright, last one. Keep your eyes open. Any pain with that?
No.
Okay. Alright, I'm going to have you stand up for me and we're just going to take a look at your posture. Okay. And then I'm going to have you walk just to that doorway and back for me. Good. And then go ahead and sit down. You said you were having some trouble sleeping. Can you tell me a little bit more about that?
Yeah, mostly I just have to have a couple of pillows back here to be comfortable enough to fall asleep.
Okay, so it's more about the position on your neck.
Yep.
All right, would you mind taking your shirt off for me? And I just want to take a look at your shoulders now. So I'm noticing no step sign here. And if I kind of come down like this, no sulcus sign either. Really don't have one. Okay, I'm going to use this tissue on your arms. Go ahead and give me your hand. It's just going to feel like this when I touch you. If you feel it, I want you to say touch. I don't want you to guess though. Okay, so go ahead and close your eyes.
Touch. 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 Touch.
Okay, I'm going to go to the other side.
Touch. 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 Touch.
Okay, good. Okay, now I want to see how strong and flexible you are. So I'm going to ask you to do a couple movements. Just follow along and then follow my commands.
Okay.
So go ahead and turn your head to the left. Good. And then don't let me move you. Good. A little bit of overpressure. And then resist my hand back to center. Good. Turn your head to the right. Good. Don't let me move you. And then I'm going to give you a little bit of overpressure. Resist back to back to center. Any pain with that? Don't answer. All right. Look up for me. Okay. And then go ahead and resist back. Good. Look down. Don't let me move you. A little bit of overpressure. Any pain? And then resist back. Good. Now I want you to bring your ear to your shoulder. Good. Don't let me move you. Don't let me move you. I'm going to put you a little overpressure and then come back to center. Good. Ear to your other shoulder. Good. Don't let me move you. A little overpressure and then resist back to center. Okay? Go ahead and bring your shoulders up to your ears. Overpressure and then don't let me move you. And then keep them up. Resist, come, bring them back down. Good. All right, arms all the way up. I'm just gonna check the overpressure and keep the other one up for me. Okay. Resist me back down. Good. Now don't let me move you. Don't let me move you. Good. And then out all the way up. Good. You can keep it up there. Tilt your head a little bit. You kind of just go. And then same thing here. Tilt your head a little bit. Okay. Bring it down to a T, don't let me move you. And don't let me move you. And then bring it back down. Any pain? Okay. Elbows back. I'm going to push it a little bit further. And now don't let me move you. And bring it back to center. Good. So I'm going to push a little bit further. Don't let me move you. And come back to center. Good. Cross your belly. Open them up. Come right here. Hold. And hold. And now bring your stomach, bring it to your stomach. And then bring it back up. Okay. Same thing with this one. Hold here. Hold here. Bring it to your stomach. And then bring it out. Okay. Elbows in. All the way out. Bring them back in. Just going to have you hold. And then hold. Same thing over here. Hold. Hold. And I'm just going to check a little bit of overpressure. Any pain with that? And any pain with that? Here. And here. A little bit of hyperextension. Wrists up. And down. Bring it back to center. So go ahead and hold here for me. I'm going to push it back a little bit. And then resist me on the way down. Good. Bring it here. Flip over. Hold. Good. And then I'm going to push you a little bit. And then go ahead and resist. Alright, palm up. Hold here. And I'm going to push you a little bit. And then come down. Good. Flip over. Hold here. Push you a little bit. And then resist on the way down. Good. Squeeze my fingers as hard as you can. Spread your fingers out. Hold them there. Alright, next up, I'm going to have you just cross your arms here. Twist as far as you can. And yep, keep your sit bones on the table. I'm going to push it a little bit. Okay, now don't let me move you. Now come back to center. Good, same thing to the other side. Push a little bit. Now don't let me move you. Now come back to center. Can you go ahead and arch back for me? Okay, and then come back to center. Any pain with that? And then come forward. Good. I'm going to push a little bit. Any pain here? Okay, don't let me move you. And then come back up. I feel like that took an hour. Alright, for the next test, at some point I'm going to ask you to move your head. And when I say that, I want you to move it like this, ear to shoulder. Don't just turn your head.
Okay.
Alright. I'm just going to push you down here, and at any point let me know if this is uncomfortable.
Right there.
Right here? Okay, can you tilt your head towards me? Does that make it better or worse?
Better.
Okay, and then tilt your head back. And tilt your head away. Worse? Better? Okay. And then come back to center. Now, was that the pain in your neck, or was that just pain in your arm? Okay, so same thing here. Any pain with that?
I feel it right there.
Okay, tilt your head towards. Better, worse, same?
Better.
And then tilt your head away.
Worse.
Okay. And then last one, I'm going to come around this way. And
Right there.
right there.
Mhm.
Okay. Tilt your head towards me. Better, worse, same.
Better.
And then tilt away.
Worse.
Okay. Okay. We're just gonna take a look at how things are moving. Let me know if any of these are painful. And I'm kind of just looking to see if anything is sticky. Checking first rib too. Alright, now I just want you to relax. And I'm gonna kind of hold your head for you. I'm just gonna turn. And then last one, just see how you're rotating out here. Okay, so I'm just gonna feel on your right shoulder a little bit. Tell me if any of this hurts. Okay, and then I wanna do one test. Yep, put your hand right on mine and don't let me move you. Okay, let's do one more. So out here, I'm gonna push you a little bit more, so just relax at
Okay.
first. And then try to hold it there when I let go. Okay.
Okay, so the next thing I want to do is just it's called the electromanubrium test, and basically it's just going to test to see if there's any fractures in the upper extremities, okay?
Okay.
So all I need you to do for me is just cross your arms like this, all right? I'm going to put the stethoscope right here on your chest, is that all right?
Mhm.
Okay. Then I'm going to tap on your elbows. You let me know if it's pain at all, okay?
Okay.
All right. It's going to be a little cold, I'm sorry. Okay. All right, Sydney. So the next test I want to look at is just going to kind of figure out exactly what's going on with some of that shoulder pain. So the first thing can I have you do, it's just called the painful arc. And I just want to see you with your thumbs up, I just want to see you bring your hands up over your head and just let me know if there's any discomfort there.
Right there.
Right there. So where is the pain right there? Right here. Okay. So you're kind of pointing to what we call the AC joint. So the next test I'm going to do is just kind of discern if that's really the cause or if there's something else causing it, okay? So for this one, can I have you just put your hand up, thumbs up, or thumb down? Can you just bring it a little bit in there? I'm going to apply some pressure. I want you to let me know if that causes you any pain, okay? Any pain?
Yes.
Okay. Where was the pain?
Same place.
Same place. Okay. So next, can I have you put your palm up? All right. I'm going to apply the same pressure. Let me know if that causes you any pain. How's that?
Nothing.
No pain there. Okay. All right. Well, that kind of lets us know that the AC is probably the culprit. So we'll address that when we get to some interventions.
Okay.
Okay, so in terms of our findings for our objective exam, initially, given the mechanism of injury, we've decided that we should refer immediately for cervical spine imaging to ensure there's no fracture there. The additional fracture screen that we completed with the electromanubrium was within normal limits. The things that we found that were abnormal, we did the cervical ligament testing and we found that her ligaments had some laxity. It was mild, but they did feel intact, and so we were able to proceed in that regard. While doing the active range of motion, we noticed the patient complained of pain in the last 10 degrees of abduction, just kind of showing us that the AC joint may be involved. The next thing that we found for the right shoulder, it was painful, but it was not limited while she performed abduction as well. We also noted limited cervical rotation both ways while we performed the cervical active range of motions, and so we intend to intervene there as well. Next, we looked at the posture, and we noted a forward head. We had tight traps, so we noted that their shoulders were a little bit elevated, and they had rounded shoulders as well, and so a little bit of that kyphotic posture. Lastly, we decided that given the mechanism of injury and some of the patient's complaints, we should also refer to her primary care to assure that she doesn't have any concussions, and so we could refer there for a screen.
Okay, so when we were doing our exam, I noticed some limited motion in your neck, a little bit of stiffness there, and you're also obviously having some pain. So I think what would help that is if we did something called soft tissue mobilization, which is like a massage, and that will just get some good blood flow, some good nutrition, get some more movement in those muscles. That'll help you with some having more range of motion and also decreased pain. How does that sound?
Sounds good.
Okay. Just let me know if you're having any increased pain.
No, my pain's definitely decreasing.
Good. Was that everything? Okay, so the next thing we're going to do is I'm just going to kind of feel how each of the individual joints in your spine are moving in your neck and your upper back. And if I find any that I feel like aren't moving as well, I'm just going to work on those a little bit and see if we can't get any more movement, and that will help with your mobility and your pain. Does that sound okay?
Yeah.
Okay, so I'm going to have you lay on your belly with your face in that little hole there. Okay, are you comfortable?
Yep.
Okay, so it felt like this one wasn't moving very well, so we're just going to hang out here and work on this one a little bit.
That's already starting to feel better.
Good. So, I know you're having some pain kind of right here on the shoulder.
Yep.
And this is where your collarbone connects to your shoulder. So, I'm thinking that I'm wanting to do some, just kind of like get some motion in your clavicle. So I'm going to do what we call lobes, which is just kind of moving your clavicle around, and I think that'll help with pain and also with getting some of your mobility back. Does that sound like something you're okay with?
Yes, please.
Okay. And as always, just keep me updated with how everything's feeling.
Okay. Yeah, that feels good.
Okay.
Yeah, that feels fine.
Good.
Yeah, that's a little tender, but it feels good.
Okay. Okay. Done?
Can you say?
All right. So similar to the the massages and the stretches that we gave you when we just did it a moment ago, I want to show you a way that you can do that at home, just kind of continue your rehab there. So what I'm going to show you is just a trap stretch. And so what you do is I want you to just grab with your probably your left side, because we saw that side was pretty tight. Grab underneath the chair, and all I want you to do is just lean your head the opposite way. Do you feel the stretch right here in your trap? If you'd like to increase that stretch, you can kind of lean away from the hand. And if it's getting a little bit too much, you can tip your head back or lean back towards that arm. All right? Thank you. Following the interventions, as is always important, we'd like to retest the measures that got us there. So we'd like to rescreen the cervical rotation as well as the shoulder abduction on both sides. And so the other thing that we'd like to look for is the rating of pain. And so following the interventions, the patient's subjective pain report went down from a 6 to a 3, and we noted less difficulty and pain as we saw abduction in both left and right arms. We also thought it was important to also spend some time educating the patient on the importance of biomechanics in terms of her posture. So while she's at the computer, working, as well as when she's caring for her child, we thought we could just quickly and easily remind her, just to keep considerate of her posture and just try to be more cognizant of that moving forward, as that could really help alleviate the pain symptoms that she's feeling at this point.